Life during COVID feels like we've pressed pause, and it won't start again until
we have a safe and effective vaccine.
The vaccine
that is safe and effective.
But even when that time comes, many people won't take it.
I have plans not to get a COVID vaccine.
You can't buy a good immune system.
I would never put a vaccine into my body.
Period. Here are three people who share different perspectives. Some say they're anti-vax, others are just skeptical. Take Holly Bade. She owns a holistic healing practice in Marin. Her reasoning is personal.
Both of my children had vaccine damage, and it wasn't necessarily that they died on the spot, but they both had clear changes in their health.
Then there's Joseph Jacks. Tell me why you're concerned.
6 words: testing, 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 and more testing. It's important, if you're going to put something into your body, that it's absolutely and totally tested.
And is it higher?
And if you ask Dana Ullman, he says he's not anti-vax, but concerned pharmaceutical companies are putting speed over safety.
I'm not anti-vaccine. But when they're doing studies now where they're not testing it against a real placebo, that's a way of hiding what safety is involved.
50% of Americans say they won't get a COVID vaccine, even if it was affordable and widely available, according to an AP poll taken in late May. And 7 out of 10 worry about safety.
I think before I would put my own endorsement on a vaccine or vaccines for COVID, I'd want to see the data too. I totally agree with them.
Stanford pediatrician Dr. Yvonne Maldonado specializes in infectious diseases. She's currently working with the CDC on potential COVID vaccines and participating in
Operation Warp Speed. That means big and it means fast.
The federal initiative aims to deliver 300 million doses of a safe and effective COVID vaccine by January next year.
We are in a hurry, but we're not in that much of a hurry that we want to make a big mistake. We need to understand why people say they might not want a vaccine.
To give you an idea, 150 of the largest anti-vaccine groups on social media and YouTube have gained 8 million followers since late March. There are at least 400 anti-vax groups that have 55 million followers worldwide. That's according to an international nonprofit tracking those accounts.
Do you think the anti-vax movement will impact how fast we get to herd immunity?
I don't think we're going to get there very quickly. There's no way we're going to stop transmission at a global level, meaning all around the country or the world, unless 60 to 70 or 80% of people have permanent or long-lasting immunity.
Now, Dr. Maldonado says it may take 2 years to get to herd immunity worldwide, assuming the vaccine is at least 70 to 75% effective. Stephanie Sierra, ABC 7 News.
Stephanie, what's the closest comparison to a coronavirus vaccine that already exists, and how long did it take to develop?
Well, studies show the closest comparison is the MMR vaccine, which took start to finish 4 years to develop, not under a year like what scientists are aiming for now with the COVID vaccine.